Welcome to OET Answers.
Occupational English Test. OET Answers Practice Test, Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. You hear a GP talking to a patient called Mrs. Mandis. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Hello, Mrs. Mandis. It's good to see you again. How are you doing today?
Hi, Doctor. Well, I've been feeling a bit overwhelmed lately.
I'm sorry to hear that. Is it related to your type 1 diabetes management or something else?
It's mostly about my diabetes. I feel like I'm doing everything I'm supposed to, but it's still hard to keep my blood sugar levels stable.
I understand how frustrating that can be. Let's take a closer look. How have your blood sugar readings been over the past few weeks?
They've been all over the place. Some days it's too high, and other times it drops really low, especially at night.
Okay, I see. Are you still using the insulin pump? Or have you switched to multiple daily injections?
I'm using the pump. It's better than the injections, but even with that, I'm struggling to get consistent results.
I hear you. Maintaining steady blood sugar levels can be challenging with type 1 diabetes. Have there been any changes in your routine, diet, exercise, or stress levels that could be contributing?
Not really. I try to stick to my meal plan and exercise regularly, but my job has been stressful lately. I think that might be a factor.
Stress can definitely have an impact on blood sugar control. When we're stressed, our body releases hormones like cortisol that can make blood sugar rise. Have you noticed a pattern between stress and your readings?
Now that you mention it, my levels do seem higher on particularly hectic days at work.
That's a good observation. Stress management might be something we need to focus on. Have you tried relaxation techniques like deep breathing, meditation, or even taking short breaks during the day?
Not really, but I'm open to trying.
Great. Small changes can make a big difference. Now, let's talk about your nighttime lows. Have you noticed any specific triggers for those?
I think it might be related to my evening meals. Sometimes I have a lighter dinner, and I don't always adjust my insulin dose accordingly.
That could be a factor. It's important to match your insulin dose to your carbohydrate intake, especially in the evening when your activity level is lower. Would you find it helpful if we reviewed your insulin to carb ratios together?
Yes, that would be helpful.
Perfect. I'll also arrange for you to meet with a diabetes specialist nurse or dietitian. They can help fine-tune your meal planning and insulin adjustments. Additionally, have you been keeping track of your hypoglycemia symptoms, like sweating, shaking, or feeling dizzy?
Yes, I usually feel shaky and lightheaded before it happens.
That's good awareness. Let's also discuss setting a temporary lower target for your blood sugar levels overnight to reduce the risk of lows. Some pumps have a feature for this, or we can adjust your basal insulin settings.
That sounds like a good idea.
Another thing to consider is using a continuous glucose monitor (CGM) if you're not already. It can alert you to rising or falling blood sugar levels in real time, especially overnight. Have you looked into that?
I've heard about CGMs but wasn't sure if it would be worth it.
Many patients find them incredibly helpful, They provide real-time feedback and can reduce the anxiety of unexpected lows or highs. We can discuss getting you set up with one.
That would be great.
Wonderful. Lastly, I want to check in on how you're feeling emotionally. Managing type 1 diabetes can take a toll, and you mentioned feeling overwhelmed. Are you getting support from family or friends?
My family is supportive, but it's hard for them to understand what it's like day to day.
That's completely understandable. Have you thought about joining a diabetes support group? Speaking with others who share similar experiences can be incredibly reassuring.
I hadn't considered that, but it sounds like it could help.
I can give you some resources to find a local or online group. You're not alone in this, Mrs. Mandis, and we're here to help every step of the way. I'll also schedule a follow-up appointment in a few weeks to check on your progress and see how these adjustments are working for you.
Thank you, Doctor. I really appreciate that.
You're welcome. Is there anything else you'd like to discuss today?
No, I think we've covered everything.
Great. Take care, and we'll see you soon.
Extract 2. Questions 13 to 24. You hear an oncologist talking to a patient called Mr. Harper. For questions, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Hello, Mr. Harper. It's nice to meet you. I understand your GP referred you to me after some recent imaging tests raised concerns about your gallbladder. Is that correct?
Yes, that's what they said. They found something unusual in my ultrasound, and I've been worried ever since. What does it mean?
I understand how worrying this must be. Let's go through everything step by step. Your ultrasound showed a growth or mass in the gallbladder, which is why your doctor wanted you to see a specialist. Based on the imaging and some of your recent symptoms, we are concerned about the possibility of gallbladder cancer.
Cancer? That's a lot to take in. Is it certain that it's cancer?
Not necessarily. While the imaging results raise the suspicion of gallbladder cancer, we'll need further tests to confirm the diagnosis. These may include a CT scan, an MRI, or even a biopsy. It's important to be thorough so we can understand exactly what's happening.
Okay, I see. But what are the chances that it is cancer?
Gallbladder cancer is relatively rare, but it's more common in people with certain risk factors, such as a history of gallstones, chronic inflammation of the gallbladder, or a condition called porcelain gallbladder. The good news is that we've caught this early enough to investigate further, which is crucial for effective treatment if it is cancer.
I've had gallstones in the past, and they've caused me some pain. Could that have led to this?
Gallstones are indeed a significant risk factor for gallbladder cancer. Chronic irritation and inflammation caused by gallstones can sometimes lead to changes in the cells of the gallbladder. That said, not everyone with gallstones develops cancer.
What happens if it is cancer? What are my options?
If the tests confirm gallbladder cancer, the treatment will depend on the stage of the disease. Early-stage gallbladder cancer can often be treated with surgery to remove the gallbladder and possibly some of the surrounding tissues. This is called a cholecystectomy.
And if it's not caught early?
For more advanced stages, we might need to explore additional treatments such as chemotherapy, radiation therapy, or targeted therapies to manage the disease. The goal is always to provide the best possible outcome, whether through curative or palliative approaches.
What about symptoms? Should I expect them to get worse?
Gallbladder cancer can sometimes be symptomless in the early stages, which is why it's often diagnosed late. However, symptoms like abdominal pain, particularly in the upper right side, unexplained weight loss, jaundice, yellowing of the skin and eyes, or nausea could appear as the disease progresses. Have you experienced any of these?
I've had some pain on the right side and occasional nausea, but I thought it was just my gallstones acting up.
Those symptoms could indeed be linked to your gallstones, but it's good that you've sought medical attention. Now we'll focus on determining the exact cause so we can take the right steps.
Is there anything I can do right now to improve my chances?
The most important thing is to follow through with the tests we've discussed. Additionally, maintaining a healthy diet, staying hydrated, and managing any other underlying health conditions can help. If surgery becomes necessary, being in good overall health will support a smoother recovery.
What about prevention? Is there a way to avoid this in the future?
Prevention is largely about addressing the risk factors. For example, managing gallstones early through dietary changes or gallbladder surgery, if recommended, can reduce your risk. Maintaining a healthy weight and avoiding smoking are also protective measures.
This is all so overwhelming.
I completely understand, Mr. Harper. It's natural to feel this way. We're here to guide you every step of the way, answer your questions, and provide the best care possible. Take it one step at a time, and remember, catching something like this early can make a significant difference.
Thank you. So, my next step is more tests, right?
Exactly. We'll schedule the tests to get a clearer picture, and then we'll meet again to discuss the results and the best course of action. If you have any concerns or questions in the meantime, don't hesitate to reach out.
I appreciate that. I guess I'll wait to hear from your office.
Absolutely. We'll be in touch soon. Take care, Mr. Harper, and we'll get to the bottom of this together.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear 2 nurses talking about an email. Now read the question.
The department head just emailed. They want us to showcase an innovative practice at next week's meeting.
That's a great opportunity, but what should we present? We've been trying out evidence-based interventions recently.
True, but did anyone document the results for the pilot program?
I don't think so. Everyone's been focused on implementation, not tracking outcomes.
That's going to be a problem. Without data, we can't prove its success.
Maybe we could at least gather some patient feedback quickly.
It's a start, but next time, we need to track everything properly.
Now look at question 26. You hear a neurologist discussing with an intern. Now read the question.
Severe headaches about 15 days a month for the last 6 months. Her medical history includes no major neurological conditions, but she's had migraines since her early 20s. She currently takes over-the-counter painkillers, which provide minimal relief, and experiences sensitivity to light during episodes.
What do you recommend as the next step?
Based on my evaluation, I would suggest starting her on a preventive medication regimen, such as beta blockers or anti-epileptic drugs. Additionally, I would explore potential lifestyle factors, like stress or sleep patterns, that might contribute to her condition.
What are the primary causes of chronic migraines?
Chronic migraines are often associated with
Now look at question 27. You hear a conversation between a physician and a patient about managing chronic respiratory disease. Now read the question.
So, Mr. Hargrove, you've been managing your condition quite well with your current medications, but you mentioned experiencing more difficulty breathing over the past few days.
Yes, I've been using the rescue inhaler more often, and even the supplemental oxygen doesn't seem to help as much during those moments.
I see. We've been maintaining you on your long-acting bronchodilators and supplemental oxygen therapy. I want to talk to you about your preferences for managing your symptoms if this kind of exacerbation becomes more frequent or severe.
Yes, I've spoken with my family and we're aligned. I don't want to be intubated or placed on a ventilator if it gets to that point.
Okay, that's helpful to know.
Now look at question 28. You hear a senior nurse talking about a new initiative that has been introduced on her ward. Now read the question. One of our key priorities is ensuring patients adhere to their prescribed medication regimens. We recently introduced a program called My Medication Buddy, which involves sending patients daily reminders via text messages and scheduling check-ins with a nurse. These reminders prompt patients to take their medications at the right time, and during the check-ins, they can share any difficulties they might be having. Patients have told us that they often forgot their doses or got confused about timings, but now they feel more confident and supported. In fact, the program has been so successful that we are planning to extend it to other departments in the hospital. Now look at question 29. You hear a clinical researcher introducing a professional development workshop. Now read the question.
Welcome to this workshop, Understanding and Implementing Patient-Reported Outcomes Measures, PROMs. My name is Dr. Hartman, and I'll be leading today's session. I am a clinical researcher specializing in health outcomes and quality of life measures. This course is not about memorizing survey tools or statistical formulas, though. I believe that the first step in engaging with PROMs is gaining an intuitive grasp of their purpose and application. PROMs allow us to hear the patient's voice directly, offering insights into their lived experiences with illness and treatment. To integrate PROMs effectively, you must understand their validity. Do they measure what they claim to measure? And their reliability. Are the results consistent? Beyond that, it's essential to grasp how PROMs influence clinical decision-making, shaping patient care and improving outcomes. Our goal today is to help you critically evaluate and effectively use PROMs in your clinical practice, ensuring your decisions are truly patient-centered.
Now look at question 30. You hear two doctors discussing the management of a patient experiencing phantom limb pain. Now, read the question.
Green's most recent pain assessment. Did you evaluate him yesterday?
No, I didn't get the chance. Let's see. Ah, here it is. His pain level was recorded at a 7 out of 10 during his last evaluation, which is quite high. We'll need to reassess his pain management plan, especially since he mentioned how disruptive it is to his sleep. He wasn't very receptive to trying mirror therapy, though. I spent quite some time explaining its potential benefits, but he seemed skeptical. Not an easy patient to convince, if you're up for another attempt.
Sure, I'll give it a go.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For question 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Extract 1. Questions 31 to 36. You hear an interview with an expert on environmental health and climate change. You now have 90 seconds to read questions.
I have with me Dr. Evelyn Mora, an expert in environmental health and climate change. Hello, Dr. Mora. Thank you very much for taking the time to join us today.
Thank you for inviting me. It's an important topic, and I'm always happy to discuss the intersections between the environment and human health.
I understand that your journey to becoming an expert in this field wasn't straightforward. Could you share a bit about your background and what brought you here?
Certainly. I began my career as a general practitioner, focusing on community health. My turning point came about 12 years ago when I noticed an increasing number of patients suffering from respiratory and cardiovascular conditions that were linked to air pollution. I started researching how environmental factors were impacting public health and decided to shift my focus to environmental health. It led me to pursue a PhD in environmental science and public health.
And you've since become an advocate for climate-related health interventions. What are you currently working on?
Right now, I'm leading a project that evaluates the long-term health impacts of climate change, specifically focusing on heat waves, air quality, and water scarcity. The goal is to create actionable strategies for mitigating these risks, particularly in vulnerable populations. For example, we're working on a public health initiative that combines community education with sustainable urban planning to reduce heat-related illnesses in urban areas.
That's fascinating. Before we delve deeper into your work, can you provide an overview of how environmental factors affect human health?
Absolutely. Environmental health is profoundly interconnected with human well-being. For instance, poor air quality is linked to respiratory diseases such as asthma and chronic obstructive pulmonary disease. Contaminated water contributes to diarrheal diseases and affects millions of people annually. Climate change exacerbates these issues by increasing the frequency and intensity of extreme weather events, such as floods, droughts, and wildfires, all of which disrupt access to clean air, water, and food.
You mentioned earlier that your turning point was seeing patients affected by air pollution. How significant is the problem of air quality globally?
It's a massive issue. According to the World Health Organization, 9 out of 10 people worldwide breathe polluted air. This contributes to an estimated 7 million premature deaths annually, primarily due to strokes, heart disease, and lung cancer. Air pollution disproportionately affects low-income communities, creating stark health inequities.
What steps can individuals and governments take to address these environmental challenges?
On an individual level, small actions like using public transport, reducing energy consumption, and advocating for cleaner technologies can collectively make a difference. Governments, however, must lead the charge by enforcing stricter environmental regulations, investing in renewable energy, and supporting research and innovation in sustainable practices. International cooperation is also vital to address global issues like climate change.
Finally, could you tell us about a recent success story in your field that gives you hope for the future?
Certainly. One example is a clean water initiative we supported in a rural region affected by industrial pollution. By installing low-cost water filtration systems and educating the community on water safety, we reduced cases of waterborne illnesses by 60% within 2 years. It's a testament to how targeted interventions can yield significant health improvements.
That's truly inspiring. Thank you, Dr. Mora, for shedding light on this critical issue.
Extract 2. Questions 37 to 42. You hear an interview with Dr. Kevin Drews on language development in preterm infants. Now, read the questions. You now have 90 seconds to read questions.
First of all, thank you for having me here today. I'm going to be talking about the research on language development in preterm infants, those born prematurely. Sheds light on the unique challenges these children face and highlights strategies to support their language skills. Today, I'll discuss what healthcare professionals, especially those interested in neonatology and pediatrics, should know about identifying and addressing these challenges. Preterm birth, defined as delivery before 37 weeks of gestation, affects approximately 10% of all births worldwide. While advances in neonatal care have significantly improved survival rates, many preterm infants experience developmental delays, including in language acquisition. Language development in preterm infants often follows a trajectory below age expectations when compared to their full-term peers, particularly in the early years. Language acquisition encompasses receptive and expressive language skills. Receptive language involves understanding words and gestures, while expressive language pertains to verbal communication and sentence construction. Studies show that preterm infants are at a higher risk for delays in both areas, but the degree of impairment varies widely. For example, some preterm infants may struggle with vocabulary acquisition or sentence formation, while others may face challenges with understanding spoken language. Several risk factors are associated with delayed language development in preterm infants. Biological factors include low birth weight, neonatal brain injury, or conditions like bronchopulmonary dysplasia, which may impact neurological development. Environmental factors, such as limited interaction with caregivers or lack of exposure to rich language environments, also play a role. Family history of language disorders can further exacerbate risks. Protective factors, on the other hand, can mitigate these risks and support language acquisition. Positive influences include responsive caregiving, breastfeeding, and access to structured and unstructured play that promotes verbal interaction. Early intervention, often initiated during infancy or toddlerhood, has proven critical for improving language outcomes. Speech-language pathologists, SLPs, play an essential role in monitoring preterm infants and providing interventions. For instance, indirect stimulation techniques, such as encouraging parents to narrate daily activities, sing, and engage their child in conversation, can significantly enhance a child's language environment. Parents should be educated on recognizing early signs of delayed development, such as limited babbling or a lack of response to sounds, to ensure timely intervention. In cases where developmental delays persist, or co-occurring conditions like hearing loss or autism spectrum disorder are identified, direct speech and language therapy may be required. A multidisciplinary approach involving pediatricians, audiologists, occupational therapists, and developmental specialists ensures a comprehensive support system tailored to the child's needs. Differentiating between delays that stem from prematurity versus other underlying conditions can be challenging, but is essential for effective intervention planning. Assessments often include monitoring cognitive, sensory, and motor skills alongside language abilities. These evaluations should also consider the cultural and linguistic background of the family to ensure relevance and inclusivity. A hallmark of successful interventions is collaboration with families. Empowering parents through education and involving them in goal setting enhances the effectiveness of intervention plans. For preterm infants, early and consistent engagement from caregivers is particularly impactful, laying the foundation for better language skills as they grow older. In summary, preterm infants are at a higher risk for language delays due to biological and environmental factors. But with early identification, targeted interventions, and family involvement, these challenges can be effectively addressed. This knowledge is vital for healthcare professionals aiming to improve developmental outcomes in this vulnerable population.
That is the end of Part C. You now have 2 minutes to check your answers.